Planning to make a trip or going on vacation anytime soon, you may need a pre-travel evaluation. Here to tell us more is Joanne Ellis with Home Rehab Express and Dr. Dean Ratcliffe. Good morning. Welcome back.
Good morning.
So before we get into this, which we were both saying, this is so fascinating. We're very interested in this. Remind people what Home Rehab Express does for people.
Sure. We're a home health care company, Medicare certified. We're able to send nurses and therapists to patients' homes that are maybe not able to get to the doctor as often as the doctor would like them to be there.
So you're able to kind of hook them up with the doctors and the care they need in their own home, which is fabulous. That's why you meet a lot of doctors in the area.
Yep.
So yeah, let's talk about this, doctor. And this is so interesting. I think a lot of people, as travel gets more accessible and we're going from this country to that country, what do we need to be thinking about before we make a trip like this?
Well, I think it's important to get a pre-travel screening if you're going to be going to a second or third world country. It's important because you're going to gain a lot of knowledge about the risks that you'll face while you're there. You can, in some cases, even gain access to the country. Let's say you're going to a country that has yellow fever. That country is going to require that you've been vaccinated, or else you'll be turned away. You won't even be allowed access unless you have a yellow fever card showing you've been vaccinated. But more commonly, also, you can learn about how you can prevent diseases, like mosquito repellents, bed netting if you're going to be out in the sticks.
Which I know is a hot topic right now.
And then there are also vaccines, medications, and also learn how to avoid high-risk foods.
Okay. So do you go to your normal, doctor, normal care provider at this point, or where do you go to have this done?
Well, you could do that. You can go to your primary care physician. I've had physicians do that, and they'll look up on the CDC website and learn about how to counsel their patient and prescribe certain vaccines and medications. More commonly, you go to a travel clinic where they're more versed on
Well, that's
the
what I was
procedures.
wondering, if they'd really know what's going on in the rest of the world, because it could be kind of quite a bit to learn.
Right. I mean, some primary care physicians take an interest in it. Most of them do not, so they'd rather refer to a freestanding travel clinic or an infectious disease doctor's office.
Yeah, and you were saying as we wrap up here that it's very important to know other countries do not have the same regulations and the same outlook that we do, we have here. So there really can be a lot of differences that it's really important that you make sure you're on top of this.
Right. I mean, at the very least, you're going to probably need a hepatitis A vaccine, a typhoid vaccine, and you're become up to date on your routine vaccines, pneumococcal, influenza, tetanus, and some specialty travel vaccines I mentioned, medications as well.
All right. Well, doctor, thank you so much for being here once again this morning. If someone wants to find out about, of course, what he does, ID specialist, and what Home Rehab Express does, where would you send them?
I would send them to homerehabexpress.com or ask your doctor to refer you to Home Rehab Express for home health care.
Perfect. Thank you both so much. And of course, we will put more info on our website as well, fox4morningblend.com.
Oh, baby, there is something in the water in the world of Hollywood. Coming up, we do a little baby talk with some celebrities and their mini-me's that are making the news.